Bonnie, and I will be your conference operator today. At this time, I would like to welcome everyone to the Optimizing Revenue Cycle and Patient Relationship Management for Healthcare Providers. All lines have been placed on mute to prevent any background noise. If you should need assistance during the call, please press *0 to reach an operator. Thank you. I would now like to turn the call over to Mr. Greg Burkett and Mr. Howard Leary. Please go ahead.
Great. Thank you so much for the introduction. And I would also like to welcome everybody that's joined today's call. Before we get started, though, I'd like to give you a little bit of background on my experience and also have Howard Leary introduce himself as well, too. As Bonnie had mentioned, my name is Greg Burkett, and I'm the Vice President of Healthcare Solutions, heading up Noble Solutions Healthcare Initiatives. I know several of the folks who are on the call today, and I joined the company a little over 6 to 7 months ago, and although I'm newer to Noble Health Systems, I'm certainly not new to healthcare, and I have close to 25 years experience working with several nationally recognized companies, and many of which that you may know from a healthcare provider perspective, including Baxter Healthcare and Cardinal Health. And in those companies, I've served in a variety of different capacities and roles from a provider and service side, pharmaceutical distribution, medical surgical distribution, and a variety of consulting and systems-based applications. So I've got a very good familiarity with overall healthcare, and although newer to Noble, certainly familiar with the intricacies and everything that's associated with a provider and healthcare provider network throughout the United States. Also, we're very fortunate, as Bonnie had mentioned, to have Howard Leary participate on today's call. Howard is our Director of Healthcare Solutions with focus on our technologies and specifically from the engineering solutions. And Howard, if you can give them a little bit better feel for your background, that'd be great.
Sure. Thank you, Greg. And like Greg, I got my start in healthcare probably 25 years ago as well. I started out working right out of high school for a local hospital, performing duties as a central supply technician. I became a pharmacy tech, and at the end of all of that, I was a telemetry tech, watching up to 48 lives at a time. And really, I just developed and established a work ethic around the fact, understanding that people's lives really depended on me. And so that was the beginning of my career with healthcare. In the last 16 years, I've also worked with many well-regarded companies within the healthcare space and working for solution providers within the contact center space. I've worked as a principal solution consultant, also as a solution architect for a public safety software company where I helped design emergency 911 call centers, and so focusing on high availability and things like that. And then most recently here at Noble Systems, helping with the healthcare vertical. So pleased to be here. Our goal is really to seek first to understand. So as we engage with you individually, we will do that. We'll listen to your needs and try to help you solve those pressing business challenges with our technology solutions. I'll turn it back to Greg now.
Great. Thanks, Howard. And a good point as well, too, because it's truly the requirements and needs of our customers that are ultimately going to drive our solution set. So your input is greatly appreciated. As we go through the presentation in more detail, we've done several site visits, and we'll walk through those experiences in a little bit more detail. But certainly want to make sure from a conversation standpoint as we get to the Q&A portion and hopefully future visits with each of you, that it's really your input that's going to drive our mutual success. Today we're going to be covering a variety of different topics, and as the title, as Bonnie had mentioned, it's a presentation we'll be focusing on optimizing revenue cycle practices and looking at applying Noble's technologies to impact the patient experience. And the patient experience is really a new focus for us on how we apply that, and it's really newer to healthcare in general, and especially looking at contact centers and how they can be impactful in those areas and really help from an overall patient satisfaction standpoint. As I think Bonnie had mentioned, the lines are muted, so in an effort to get through all the materials on our presentation today, we're going to hold any questions until the end. We'll have a Q&A opportunity. And also, since it is muted, basically it's an opportunity for you to be able to type in questions So as we get a little bit closer to that, or Howard, if you want to explain how they would be able to do that, so as we go through the presentation, any questions you think of, you can actually indicate that in writing. Howard, you want to explain how they can do that?
Certainly. Thank you, Greg. Yes, if you will look at the top of your menu bar on Microsoft Office Live Meeting, you'll see a Q&A section. And when you click on that, there will be a drop-down that will allow you to type in questions as you go through the presentation, and then we will address as many of those as we can at the end of the presentation.
Great, thanks. Okay. What I'd like to do first is just go through the agenda real quickly here, fairly straightforward. What I'm going to do first is I'll provide a market overview, healthcare market overview. Really, this is a global State of the Union as it relates to Noble's presence out in the marketplace and some observations that we've seen in the healthcare market. Then we're going to look at contact centers and framing up our solutions or Noble solutions focused on the continuum of patient care. So this is a little bit newer approach, looking at things a little bit more holistically as far as the patient throughput and things like that. So we'll get into some more detail on that. And then we'll look specifically and take a deeper dive on revenue cycle management practices, ROI factors, looking at safeguards, regulatory compliance, the patient experience, using technology to enhance patient satisfaction. Then we'll have a conclusion slide and wrap up, and as I mentioned earlier, opportunity for Q&A. As I mentioned earlier, I recently joined the company, but Noble Systems is not new to the healthcare market. And if you look at it from the inception of the company in the late 1980s, Noble Systems has had a variety of different third-party and first-party service providers in the healthcare space. What we've done is really looked at this a little bit more closely as far as the strategic market. So that really kind of frames up this next slide. So we have over 30 healthcare customers as part of our base business. It really ends up being more than 30 because a lot of the folks on the call today and other customers that we have are integrated delivery networks that have multiple hospitals, 9, 10 plus hospitals within their portfolios, as well as standalone hospitals. We also have quite a few physician and clinic practice groups as part of our overall client base, and then third-party service providers from an outsourcing standpoint. Now, these customers are using a variety of our solutions, including premise and hosted or cloud-based platforms, and also use agent-assisted and self-service applications such as text-to-speech and IVR technology. Last year, Noble Systems really decided to make a big investment in the healthcare market space and formed a group focused exclusively on healthcare, thus my joining the company about, like I mentioned, 6 to 7 months ago, and then Howard Leary supporting it from an engineering solution standpoint. And really what we're trying to do is help our customers and clients manage with all the changes in the direction of healthcare and the Affordable Care Act. So those are really the underlying goals that Noble Systems set out to accomplish. The first major event that we had, and there's a couple folks on the line today that I know have participated in this. At the end of last year, we had an executive healthcare summit in Florida where we actually had several of our clients come in across the spectrum of our customer base, attend a 3-day roundtable meeting in Florida. Really primary focuses there were to look at the challenges, overall challenges facing healthcare, taking a deeper look at regulatory compliance and safeguards for healthcare, but the bulk of the time was really having roundtable discussions on industry best practices, revenue enhancement, and patient-centered communication strategies. And this, again, is, as we mentioned before, it's really the input of our clients that are ultimately going to drive the solution set that we develop going forward. I thought it was interesting to include this. We had actually put together a survey of those executives and contact center folks that had attended the conference. This is actually the top items that they indicated that they were challenged with and were facing. So if we look at it here, obviously pretty straightforward as we look around the diagram here. Contact center operations comprise the majority of the concerns and focus, followed by regulatory compliance, revenue cycle management, business, technology, and customer experience, as you see the rest of the graph. But the good news is, and what we really hope to accomplish today, is the things that we're able to help support as an organization working with our clients, the contact center operation impacts all the other areas within that wheel or within that diagram. So again, I just want to give you a little bit of a sampling as far as what your other peers in the contact center space are facing. I thought this next slide would be interesting because this is actually from American College of Healthcare Executives, and this is top issues facing healthcare in general. The last diagram was actually healthcare for contact center concerns. This is actually healthcare in a general sense. We should be getting the 2012 list of top issues here shortly. Typically, you'll see that in modern healthcare, some document like that or periodical. But really, there's a lot of parallels. So if you look at financial challenges, healthcare reform, patient quality and safety, governmental mandates with regulations, the hospital relationships, physician-patient relationships, patient satisfaction, technology, of course, here. This one is actually showing being centered more on electronic medical records, or the EMR, but there were also subcategories, and it was technology in general, and then personnel shortages. But I thought it was just interesting that the parallel, the microcosm of the contact center space really parallels to the healthcare industry as a whole. Next, in looking at this slide, over the last couple of years, there's been a significant shift in healthcare focus, really a paradigm shift. And this is probably, if we had one slide that we could speak to, boy, we could spend a lot of time as it relates to information here. And if you look at the left column, that was a pre-paradigm shift to where the direction is moving now from a healthcare standpoint. And it really starts to resonate as far as leveraging different things from a technology standpoint as we look at each of these categories. It used to be volume-based care. Now it's value-based care. The length of stay and managing the overall patient length of stay, to nowadays it's the preventing readmissions. There's things that you can use, technology and telephony services as far as patient communication and, discharge instructions, follow-up appointments, and all those types of things that can help prevent readmissions. And because obviously readmissions for the same disease states aren't reimbursable. It used to be, managing the IT budget. Now it's meaningful use of the IT budget and meaningful use of IT. And just really to my thoughts on this, it's really from IT is going to be paramount, not just for success within the healthcare environment, but really ultimately survival. And there's a lot of articles that you can read, and those are really going to be some of the tipping points in the overall healthcare climate as it relates to successful operations. We'll go down through the rest fairly quickly here, but episodic care to relationship-based care, managing that with a patient, acquisition to retention of patient, volume-based payments to the accountable care organization and quality outcomes model, and then lastly, clinical results to the patient experience. This one is obviously important as the patient is becoming much more empowered on selecting their provider and ultimately how that provider may be reimbursed for the care that's been given. Next, Howard and I have had a chance to get out to several of our customers in the third-party market, third-party collection services, as well as healthcare providers themselves. And what we've seen are just a couple quick observations. We've seen a little bit of a fragmented approach across different departments between clinical and non-clinical. So we see some opportunity there because there are certain applications that one department may be using telephony service and another one may be using telephony services. So we're really trying to cross some of those bridges and bring those different departments together because there can be some shared resources, some shared investments, and capacity relative to the overall system. Again, looking at it a little bit more globally. Optimizing contact center utilization, we've seen a lot of instances, is newer territory for providers, so there's a renewed interest in looking at the contact centers and optimizing that. And really the next points here are probably the most important, and that's really understanding the investment or the return on investment, because what we see is a lot of times the ROI is undervalued as far as what the deliverables can be. So as you'll see on the points here, understanding the true delivered return on investment, opportunities to compress revenue cycle, the revenue collection cycle, impact on patient satisfaction, and then leveraging the IT solutions, as I mentioned before. Lastly, looking at the third party and outsourcing clients that we work with, what we see is their primary focus is on collections, and we see a huge opportunity for them to provide services, for their clients, additional services such as scheduling and appointment confirmations. So really a lot of application for them as well. Moving on, want to actually present what I consider a new approach for Noble Systems in the way that we're looking at telephony and contact center applications, and really looking at it across the continuum of patient care. It's a big focus area with hospitals to understand the spectrum and how every one of these technologies can apply to their patient care. And another thing to note as well, too, as we look at this in a little bit more detail, with the third-party service providers, for them, I think it's helpful to understand what the hospitals and healthcare providers are challenged with, just so they have a better understanding as it relates to applications and understanding the challenges that their customers and clients are faced with. Again, Noble Systems' primary goal is to look at healthcare in a broader scope. On our site visits that we've gone and performed out in the field, what we're really looking to do is identify and understand current processes associated with the operations, determining the interaction between different departments, and better understanding how those technologies are applied, and then the types of technologies that are in place as well, too. And from a takeaway standpoint, our ultimate goals, based on this observation, has been to create, in essence, a enhanced value proposition that's specific to healthcare providers. We have a lot of non-healthcare providers or healthcare clients, but there's a lot of unique needs within the healthcare space, so we've really tried to hone that value proposition in, determining best practices and being able to deliver those to improve financial results and process improvement, ensuring safeguards are in place to meet regulatory requirements, and as I mentioned before on the return on investment modeling, to make sure that we're able to communicate that in an effective in an effective fashion to address the financial concerns of the healthcare providers. Moving on, one thing, and this is really key to understanding of overall healthcare call flow, we basically created this diagram to look at it across the spectrum from pre-access to internal services to post-discharge, and then understanding all the different interactions as it relates to the calls that may take place between the patient, in the contact center, the patient and the healthcare provider, and then the payors and the contact centers and patients as well, too. So basically what we look at here are the different functions that are performed under each one of these different segments. So we have pre-access, where we have patients scheduling, appointment confirmations, insurance verification, and so on. Then on the flip side, we have the post-discharge, which would be collections, satisfaction surveys, triage services, discharge instructions, and other functions that happen there, as well as the payors, where you have coverage qualification on the pre-access and payment for services on the back half. New to some of the activities that we've been focusing on has been looking at some of the internal services that are actually performed within the hospital and healthcare space. That would be facilities and engineering, patient transport, MIS support services that all have needs for inbound and outbound calls and skill-based routing and things like that, that you can actually leverage telephony service there too from a common investment standpoint. What we find probably most impactful from a revenue cycle standpoint is what's done in input on the front end has very significant downstream impact on the back end, and can really stretch out the collections process. For instance, if all of the data is not collected from insurance, insurance approval or insurance information, phone numbers, best contacts on the front end are going to have significant downstream ripple effects, where then the post-discharge activity is going to have to go back to get that information. Another example would be using contact center technology for discharge instructions and follow-up scheduling to ensure that there's not any readmissions for same disease state. And as we had mentioned earlier, those are non-reimbursable items to healthcare providers. This next diagram here is really a little bit different interpretation of what we had seen earlier, so I'm not going to spend a lot of time on this. But again, for third-party service providers, it may give them a little bit better feel from a flow standpoint, from a pre-care to a post-discharge. What this does, it just extenuates the thought of the call flow, but breaks it into the buckets and associated tasks in, application within each one of the buckets, from pre-care to the healthcare provider interfaces, third-party solutions within that, and then post-discharge contact applications. And probably the most important reason to show this slide is looking at the desired outcome. So if we look at the right-hand side there, obviously the goal to drive agent efficiency, enhancing patient satisfaction, improving collection results, ensuring regulatory compliance, and leveraging those investments. And then below that line, you actually see the noble advantages. What I'd like to do now is have Howard go through a couple of examples or specific examples on how our solutions can help optimize the call flow and workflow process. So Howard, if you would like to do that, that'd be great.
Okay, thank you, Greg. So one of the things we're going to do here is just go through a couple of high-level contact flows, if you will. And this first one is really an inbound contact flow where a patient or a family member of a patient might place an inbound call into, let's say, the hospital or the patient financial services department and so forth. And you can now begin utilizing the IVR to make some decisions about how you're going to route that call. Now, they may have called in, for example, to speak with the scheduling department, but you may have, as you've identified and authenticated the caller, you may find that they actually have an outstanding balance, a copay that is due, and so you may want to send them to either the self-pay department or collections or some other function, and that could be either an automated process, reducing the cost to serve, through the IVR, where you just simply prompt them for payment, or you might utilize an actual agent. So at that point, you would then, after the identification and authentication, you would then route the call to the most appropriate agent or automated self-service application. One of the things that we've noticed is that, this concept of customer or patient satisfaction and doing post-call surveys is very important among our healthcare base. And so there are a variety of ways that you can handle that. You can prompt the customer up front within the IVR if they're interested in taking a survey, and then automatically at the end of the call, transfer that call or that caller into an IVR to take that post-call survey. The idea here is to really take that decision out of the agent's hand. We find that in our experience with different customers that if they allow the agent to offer the self-service, the survey, we're only seeing that offered between 1% and 3% of the time, and it's typically on a good call that they will offer them the opportunity to take a survey. So it's important to take that and automate it in such a way that the agents really don't make that decision. Clearly, there are things around opt-ins and things like that that you'll need to consider as well, and we'll help you as you design those systems and solutions. We'll help you think through some of those options. In this particular case, it looks like we had a little formatting error, but basically the concept here is that we want you to know that we're going to help you to collect more money, to generate more revenue, so to speak, to help you to manage those collection costs by automating where possible and streamlining the process, getting the patient to the right person at the right time, and then maintaining compliance. So everything from identification and authentication of the caller for HIPAA compliance can be done at an automated level, but also at the agent level as well to ensure that you are HIPAA and HITECH compliant.
Howard, just so you know, the formatting looks okay on my screen, so we should be okay.
Oh, excellent. Very good then. So then in a similar situation, though, after you've handled that self-pay or co-pay issue, you may also find that the patient needs to speak with someone else. so they may ask to speak with the scheduling department about an upcoming appointment. The agent may or may not be able to handle that kind of call. So if they're not able to handle that call, then you'll want the ability to transfer it to another queue of agents. But what's key here is the ability, now that all of the agents are on the same system, we can now have the ability to transfer both the voice and the data to the new agent, to the scheduling department. And so that minimizes the interaction time. It makes the agent or the patient feel more comfortable that, everybody knows who they are and what they're calling about and that type of thing. Now, your policies and procedures may still require some level of HIPAA authentication and challenges, to identify that person. But by streamlining the information flow, you can reduce that handle time. So those were just a couple of examples of how our systems can be used, again, to generate more revenue, to manage those operating costs, and to maintain compliance as you're dealing with technology in the contact center for healthcare.
Great. Thanks, Howard. And we're going to try and do that with each of the sections here. We'll give you, some information, some general information, and then really try and tie it into some actual applications. I know we're going through some of this fairly quickly. What our goal is at some point to have future webinars where we can take a deeper dive on each one of these, but we want to get some of this information out in a general sense. And the next section, obviously, is the central focus to all contact centers and wanting to positively impact the revenue cycle. So in this section, we're going to take a deeper dive into our revenue collection capabilities and look at the ROI factors that are associated with applying our solutions. And again, being able to do this in a fashion that from a contact center manager or director, you're able to take that information upline to your executive team and have meaningful, baselines, examples, ROI models that you can take upstream or upline with your team to justify any investments. Now, we've broken this into 4 key areas that we're calling the 4 pillars, and Howard's going to walk through each one of these areas in a little bit more detail. Howard?
Okay, great. Yeah, so again, with that concept in mind, there are 4 real major ROI factors that we see or healthcare organizations using as they're justifying the cost of contact management solution like the Noble solution. Improved productivity being probably the key point here. Obviously, that productivity allows you to collect more revenue. Going from a manual to just a preview dialing capability, for example, just looking at the outbound capabilities, gives you the ability to dramatically increase your appointment setting scheduling or capacity, or even to have the ability to handle more collection calls. You also have the ability to automate a lot of that. So not only do you have preview and predictive, but you also have the automated messaging that you can do, and we'll talk about that in the reduce the cost to serve. The key here is right party contact. So our solutions have been benchmarked against leading providers in this space, and we feel very confident that you will see, a very efficient right party contact rates that you will not see with other solutions. So we wanted to just kind of put that there. But the more people you talk to, the more money you can generate, the more appointments you can set, which obviously is a generation of revenue downstream as the patients go to the different procedures and tests. You also, from a reducing the cost to serve perspective, you can, and I've got a case study here in a slide or two to show you, you can dramatically reduce the cost to serve by automating appointment scheduling or automating self-pay in the IVR so that, you're not having to front that with an agent cost. Just reducing the amount of time that an agent has to deal with looking up an account by automating the screen pop of various applications, whether it be Cerner or Epic or any of the other clinical information systems that you might be dealing with. Anything you can do to automate that based on identifying and authenticating that caller up front will help reduce the cost to serve, and it'll certainly improve the patient experience. This last point on reduced cost to serve is really important, and as we've seen organizations really start thinking about disaster scenarios where there could be any type of epidemic, there could be a hurricane come through, a snowstorm, anything that would prevent people from actually making it to work or traveling the streets to get to work. They now can address those situations as well as seasonality. So certain locations will see seasonal spikes in the population, and we'll see more activity in those healthcare centers as a result of that. And so by providing the ability to work at home, you give yourself more flexibility. You don't have to expand again into adjoining office space and things like that to address those spikes. From an administrative simplification, and now administrative simplification is a big issue within insurance companies in the healthcare space, but also just in the delivery of healthcare in general. And so we've taken care to put automation into the system that will allow things like for outbound campaigns, the automation of that list building based on templates and profiles that you would set up. And that alone can reduce your administrative effort. But then also just the ability to, you can't manage what you can't see. I think that's one of the principal axioms in business is that you can't manage it if you can't see what's happening. So we want to provide you with real-time metrics and dashboards, granular alerting and things like that through different applications, and I'll show you Harmony in a few moments that will address that. And then probably the biggest area that's getting a lot of focus right now is administrative and technical safeguards. So HIPAA and HITECH really have told us that, and even the Affordable Care Act now points back to HIPAA and HITECH, that there's things that you have to do to control and protect, personal health information and personally identifiable information. Anytime we've been taking credit card payments throughout the collection industries or any other industry or sales even where you're selling medical devices, you need to have a PCI compliant solution. And so we've provided mechanisms that ensure encryption over the wire, encryption of any data or recordings that might be at rest on the system, as well as very granular access policies so that someone doesn't have the authority to just come in and turn off compliance control mechanisms. So that's just a real quick overview of these four pillars of the ROI factors. When we look at the actual, anecdotal evidence, if you will, from talking with different customers, we see a lot of different impacts that the Noble system has made, whether it be helping them to just be faster and more responsive. Anything that you see here in the green flags really represents real-world examples of where the Noble system has improved the ability to manage costs or to generate more revenue. The orange flags here really speak to risk management. So if you think about the risks associated with not having a compliant application that can help you manage things like, just for example, Fair Debt Collection Practices Act, if you're moving into that area to take on collections. We had one healthcare organization case study here that basically said that they paid $2.8 million in penalties because they didn't have a solution like ours in place to manage and prevent calling before 8 a.m. and after 9 p.m. So that was a very key risk management issue that they saw. Now, what we will do is help organizations to go through and do an estimated benefit analysis, and this is a detailed study where we come in and do an assessment with your organization to the extent that you're able to share cost data and things like that and volumes, call volumes and that type of thing. We can show you and help you quantify what the estimated benefit is. And just looking at something as simple as an improved right party contact rate what will that do to your ability to generate revenue? Or improving call volume capacities, does that give you more flexibility to deal with seasonality, or perhaps the ability to either reduce staff or to expand the call volumes that that same staff are handling? So we'll go through that with you.
And to follow up on that, Howard, too, what we're trying to do is create a scenario where we're able to provide empirical data rather than conceptual ideas, but really being able to baseline and track that through to fruition from a true deliverable return on investment.
Exactly. And one of the things that we've shared are different case studies within the healthcare market, and these were just some examples of where utilizing automation dramatically reduced the cost to serve, and at the same time improved collected revenue. And so you can see from these different examples that from an automation perspective, like in providing self-service for payment of outstanding balances, or even the self-service to automate confirmations to different appointments and things like that, the cost might be anywhere from $8 to $15 a call if the call is handled by a live person, when you consider all the loaded costs behind that. Whereas if you automate the call, it could be as little as 25 cents a call and still be personalized, still be very effective for a large variety or large percentage of your customer base, your patient base. And then the last point here on this case study that I think is really important to look at is that this organization saw an increase in their ability to handle both inbound and outbound calls by moving to an automated system. So they increased their inbound volume capacity through efficient call blending and effective outbound pacing. They were also able to increase their outbound calling as well. And so this was, I think, a really powerful case study that we wanted to be sure to share. Greg also asked me to share with you a number of just very brief introductions to the product lines. And the first one that I wanted to show you was Harmony. And with Harmony, you have the ability to look at management dashboards of what's happening in the contact center. And you can do that through a web-based interface that's compatible to work on your laptop, your Android tablets, your iPads, your smartphones. And what it does is it gives you the ability to see what's happening in real time in the call center, individual agents, what they're working on, what calls are on hold, and so forth. And you can even set up very granular alerts that will send email notifications to you no matter where you are, so that you can keep a handle on what's going on in the contact center. So I thought that was a very, just a key thing that we'll spend more time with you if you'd like to hear more about that. From the administrative simplification and automation process, we mentioned earlier there are list scheduler capabilities that help you to automate routine workflow. This really improves your management efficiencies by reducing the administrative effort necessary to set up different outbound lists, whether they be for automated blaster type campaigns or collections or any other type of agent assisted work. But then also establishing systemic workflows that really execute automatically, and that's the key thing, so that you know that even if your system administrator doesn't make it in because it's snowing or there's a hurricane or they're sick, they got the flu or something like that, that your system is going to operate the way you expect it to on a regular schedule, regular best practices approach. We also wanted to speak to administrative simplification from an agent perspective. We'll give you, again, in a future webinar or in in-person demos, we can talk about how the agent application, which we call Composer, would allow you to do things like taking notes. One of the key areas where agents spend a lot of time is in the after-call work, in documenting the call, and this is just a necessity with HIPAA and HITECH and the Affordable Care Act and documenting those different interactions. So the more that you can build intelligence into your application to say, I know that the agent did these things as they progressed through the workflow, then you can automate the note-taking for the agent, and they can just go in and make minor modifications and confirm those notes and move on to the next call. One of the things that we noticed empirically while we watched different agents is that they have a tendency to, particularly when they're monitored on after-call work times, to go ahead and release the call, take the next call, be speaking with the next patient, and still trying to wrap up their notes because they don't want long call times or long after-call work times. And so, so really what you've done is you've now taken that agent away from the focus of being here now with their current customer, their current patient. And so there's things that we can do to help you observe that and then to solve for it. There were also some questions out there in some of the early feedback about workforce management and how that can be utilized in a contact center to improve operational efficiencies. And we can really help you here with workforce management solutions that help you to ensure that you have a scientific plan for addressing differences in call volumes, whether it be seasonal call volumes or just your daily and weekly call volumes. This includes inbound, outbound, and multimedia demand sources. So I can now start looking at scheduling based on, email call volumes and social media and things like that, in addition to my inbound and outbound call volumes. Workforce management helps you to optimize the schedule based on, the skills needed and the call volumes that are expected, but also can help you optimize when people should take lunch breaks, when they should go in for training or in services, and so forth. So there are a variety of key benefits to automated workforce management. We also realize that everyone seems to have a smartphone these days. The agents want instant access and remote access to their schedules and things like that. And when you start changing when people come in and come out, start their schedule and end their schedule, you want to have a way of communicating that. And so we've provided a mobile application that will allow agents to go in either through a website or even through their smartphones to access their schedule, to request time off and different things like that. We also wanted to talk about healthcare safeguards and regulatory compliance. This is a key issue that we see come up in almost every call that we go on. Somebody needs to own this process at each individual operation, and there's three major areas that the Affordable Care Act, HIPAA, and HITECH really point back to, and those are administrative, physical, and technical safeguards. When you think about administrative safeguards, you're thinking about access to the system, verifying the entity that's asking for the information, integration with your Active Directory or LDAP, so that you use the same credentials to log into the system that you would to log into your laptop or your PC. But then there's also things like physical concerns that really amount to whether you're premise-based or whether you're hosted with us. If we host the solution for you, we have very tight controls around administrative access or physical access to buildings and systems, and so we've got that. We can help you with consulting engagements through partners of ours to verify not only our compliance, but also even your own compliance and how you implement your solutions. And we can support replication and disaster recovery. This is key. We're seeing a lot of our premise-based customers actually looking to us to provide replication and disaster recovery solutions in our hosted cloud, and that's a trend that we're seeing across many industries as well as healthcare. And then technical safeguards really come down to things. How do you improve the integrity of the data? How do you ensure that you've got mirrored drives and hardened OS and different things like that? So we help with encryption. We help you establish a technical safeguard or a series of technical safeguards to be in compliance with those policies. Okay. When you think about just noble compliance in general, and this is just a sampling of 4 of our major solution lines, you can see that we've really taken into consideration compliance in every product that we build. And so, it's just important to remember that there is a key component called compliance that is in every technical decision that you make. And so we can help you with those areas in terms of securing transmission, ensuring compliance with things like FTC pacing or time zones, and just a variety of things, even wireless list management screening and things like that for accessing mobile phones. This is just a quick screenshot about access policies and security compliance, and we can give you a more full demo on this. But for example, here I've highlighted the compliance lockdown access policy, and I may not want to assign that to every person that has access to Maestro, which is the management portal. I would want to reserve that capability to maybe a system administrator so that just not anyone can go in and turn off my compliance lockdowns. Okay. Also, let's computer froze here for a second. Also from agent scripting, I mean, talk about HIPAA compliance. One of the things that we found out, and I've got in the next slide here, is that a large percentage of calls do not necessarily get the HIPAA challenges that are required in terms of identifying and authenticating the caller. And so by scripting this into the agent interface and their workflow, an agent can actually go in and checkbox off the 3, 4, 5 different points of verification that they use before verifying a customer and moving on. So that gives you some documentation as well on what HIPAA verification took place. From a speech analytics perspective, and just a few more slides here before turning it back to Greg, we've taken a look at information out there, and we can do this in your operation as well, where we can load your call recordings into our speech analytics solution and start looking at things like mention of your brand name. That's important to you as you interact with your patients. Mentioning the brand name of your hospital or physician care unit or your company. Whether or not calls contain at least one or more HIPAA challenges for verification of the caller. In this case, we saw that 60% of the calls did not have HIPAA challenge. So we wanted to go in and dive deeper and see what's behind that. So I'll show that to you in a moment. But then other things like patient responsibility index, so things that indicate that, hey, this is your patient responsibility, your portion of the payment that's due, and that type of thing. So with speech analytics, you have the ability to go and actually analyze 100% of your calls for the actual content of the call as opposed to just how it was dispositioned, what code was used at the end of the call. You can now see what actually took place in those calls. If you combine this quality initiative data with quality metrics, you also can now begin to see why certain things might be happening. So why 60% of the calls did not have a HIPAA challenge in them. Well, we found that about 50% of the calls were less than 2 minutes, some of them less than a minute. And so when you look at that distribution of calls, you might exclude those from your analysis because perhaps they were too short for there to have been any need to do a HIPAA challenge. Okay. We do give you different interfaces to allow for that searching, of that forensic searching, if you will. And the idea here is really to take your quality assurance personnel and managers and turn them into forensic quality assurance investigators so that they can go in and do these detailed searches based on the content of the calls and whether or not you're meeting those different quality initiatives. Okay. So at this point, I want to turn it back to Greg to just kind of wrap things up for us.
Absolutely. Thank you, Howard, and good information. As you can see from the previous slides, we certainly take regulatory compliance very seriously, and you can have confidence, as it relates to our solutions in that regard. Also, we have partnerships with some companies where they can come in and do a full-blown assessment, compliance assessment. So certainly feel free to reach out to us as far as more detail on our solutions, plus some of those other services that we can provide. In consciousness of time, I'm going to move through this pretty quickly because we do want to answer a couple questions as well, too. A newer area of focus within the healthcare contact center space is helping manage the overall patient experience, and this is certainly going to become a much more important focus with the accountable care organizations and the Affordable Care Act models, and really with a lot of reimbursement rates and other factors driven by that overall experience and patient satisfaction. I tried to come up with some buzzwords or a statement per se from Noble Solutions standpoint and investigating a definition of the patient experience. The Barrel Institute did it the best, so I've got a quote here from them. The sum of all interactions shaped by an organization's culture that influences patient perceptions across the continuum of care. And this really takes into consideration what we're trying to do as far as looking at healthcare a little bit more holistically across the continuum of patient care. And it's really important for organizations to get, in essence, their arms around this from a culture standpoint and from a strategy. These are definitions, and I'll just go through these very quickly. Interactions are all the touch points of people and patients and contact center telephony activities. Culture is obviously the healthcare provider and the company. Perceptions, what is recognized and understood by the patients. Perception becomes reality. You understand how important it is. A patient could have a good outcome but didn't like the flavor of Jell-O, and their perception of healthcare can be skewed by that, as well as their interaction on the front end and the back end from an insurance verification to a collections process. So very, very important as far as managing overall patients' perceptions. And again, continuum of care before, during, and after, the pre-access to post-discharge. So thought that was important to draw out. These are the areas that healthcare providers can focus on to leverage their contact center technology and have tremendous impact in communicating effectively with their patients to help improve their perception and their overall care experience. And very parallel to what we've seen before as far as pre-care with appointment scheduling, appointment confirmation, insurance verification, copays, the internal provider services, because that impacts as well too, patient transport, dietary requirements, nurse triage services, and post-discharge contact solutions that are associated with collections, patient satisfaction surveys, and things like that. I do want Howard to just give a couple quick examples, and then we'll go ahead and wrap up. We got a few minutes late start, but we should be in good shape here in the next few minutes. So Howard, if you can walk through these quickly, that'd be great.
Certainly. So just wanted to make 2 points in terms of when we think about the patient experience. One of the key things in dealing with the contact center is getting that getting that patient to speak to the right agent. So we have the ability to do skills-based routing that would do everything from language-based skills routing to skills for particular types of calls. And so you have that capability within our solutions to do skills-based routing. And then also another primary way that you interact with the customer is through the IVR. The IVR can be used for self-service. It can be used for inbound self-service, but also for outbound self-service. So one of the complexities of dealing with an outbound IVR is how do you treat a human voice differently from an answering machine? You're probably not going to find it effective to ask an answering machine to press 1, for example, to speak to someone. So when you know it's an answering machine, you give a different treatment than if you know it's a human answer. And so the system and solutions that we provide can do that. And all of that really just speaks back to that patient experience.
Great. Thank you, Howard. Well, we basically just scratched the surface as it relates to the patient experience, and I'm sure you're seeing more of that from a focus from a overall healthcare provider standpoint, and if not, certainly will in the future. In conclusion and wrap up here, we've covered a lot of information on this call. Our goal is really to have, as I mentioned earlier, future webinars to drill into more specifics. But in wrapping up this call, really the primary question would be, why use Noble Systems for your healthcare solutions? And we feel very confident that our solutions and our approach to healthcare can drive true value and real value for our customers and prospective clients. Hopefully, we've demonstrated today, as it relates to the different areas that we focused on, we've got a dedicated sales and support resources focused exclusively on healthcare, our unified solutions that we have across the continuum of patient care, pre-access through post-discharge, and also demonstrating through some of the examples our comprehensive contact center functionality, premise-based or whether it be hosted solutions with predictive dialing, agent scripting, skills-based routing, IVR, self-service capabilities, automated text-to-speech messaging, managerial control and reporting capabilities, as well as enhanced solutions such as workforce management and speech analytics. As we had spent quite a bit of time on looking at the financial implications of the contact centers and the workflow processes, so we've really worked hard from a robust ROI, developing ROI modeling tools and best demonstrated practices. Again, looking at the ensuring healthcare regulatory safeguards are in place for the facilities and the customers that we work with. And then lastly, impacting the patient experience and helping drive overall patient satisfaction. So these are just a few of the key things that we feel are important in differentiating Noble Systems. And that really concludes the presentation portion of our meeting here today, or our call. And what I'd like to do in consciousness time, we're just a couple minutes afterwards, but we're going to answer just a couple questions that came over that people had texted over to us. But certainly feel free to reach out to us where we can go through it in more detail. One of the questions that we have here, and Howard, this would be for you here, do you have to purchase everything as a unified system, or are you able to buy specific modules or solutions individually?
Yes. Oh, Greg, I'm make sure I was off of mute there. Yes, absolutely. You can purchase individual parts of the solution. There are certainly key advantages to buying a unified system and the integration and so forth. But we routinely work with customers who have already made investments in certain parts of the technology and might, for example, just want to buy speech analytics, or they might, want a targeted outbound capability or IVR capability and so forth. And so we routinely work with customers who have already invested in other technologies.
Great. Thanks, Howard. We'll just handle one more, and then we'll go ahead and wrap up the call. We have one here, looks a little bit more specific, but will software updates made to Nuance Vocalizer 5 be pushed to those that have purchased the software prior to new updates at no additional cost? I'll take that one, Howard. And actually, unfortunately, due to licensing requirements from Nuance, new text-to-speech license must be purchased to migrate from older text-to-speech engines, pardon my pronunciation there, from Speechify or RealSpeak. So if you get to that point from a client perspective in answering your question, what we can do is look at your overall licensure and requirements. But unfortunately, that's strictly a pass-through from Nuance, but we can take a look at that in a little bit more detail. So would actually like to go ahead and wrap up the call. We're a couple minutes after. Hopefully this has been a good use of your time today. Certainly feel free to contact us. If you have any additional questions, we can take those further questions offline. We'd be more than happy as well, too, to set up a site assessment if that's something that you're interested in. So either contact myself or Howard as it relates to that, and we can set up some time at your facility. And on a final note, and really in conclusion, we need your input. It's really important for us to understand your requirements, and as we had said before, your ultimate requirements and need as a healthcare provider is really what's going to drive us on our development in future technologies and solution sets for our customer base. So on that note, thanks again for everybody's participation on the call. And until the next call, just want to wish you all continued success with your organizations, and we'll talk to you soon. Take care.
Thank you. This concludes today's conference call. Participants, you may now disconnect. Presenters, please hold the line.